Mr. Doggett.
Thank you, Mr. Chairman. It has come as quite a surprise this morning to learn that the focus and purpose of this hearing is to determine whether the Affordable Health Care Act is on track, because the people that are conducting the hearing when it comes to health care have been very zealous on the derailment program for health care. They have offered no constructive suggestions. It's never, how can we make health care work better for the American people? It's always, how can we derail it? I'm surprised, in fact, that they even have time to have a hearing between the repeal votes because we've had so many of them. 2.5 years ago, in this very room, we had our first hearing at the beginning of the last Congress on the repeal of Obamacare. And the House proceeded to repeal it, vote number 1. The next day, it passed a 2-page bill that contained 12 platitudes about health care. And that's the last time we've heard about those platitudes in terms of any legislative action, except for one bill last year that provided tax breaks for Tylenol. The alternatives being offered to the American people to Obamacare is really nothing care when it comes to legislative action in this committee and on the floor of the House. Now, there are many problems with the Affordable Health Care Act. I wish your efforts to try to see it effectively implemented weren't day after day being undermined and underfunded and interfered with. But tell us, if you would, Mr. Cohen, on October 1st, because I've never thought that their attacks were about denying the IRS power or denying you power. They're about denying rights to the American people that they are now entitled to under the Affordable Health Care Act. On October 1st, if you're among the millions of uninsured people in Texas that don't have any way to get insurance right now, what rights do you have then as an American citizen under this act?
You'll be able to submit an application either online or in person or over the phone or on paper. You'll be able to determine whether you're eligible for a Medicaid or CHIP on the one hand, or a subsidy in the form of an advance payment of a tax credit on the other. You'll be able to shop and choose a private health insurance plan that you want to enroll in, and beginning in January, payments you'll have to make a premium payment, but in addition, that amount of that advanced premium tax credit will go directly to the insurance company and help pay for that coverage.
And if you're working at a lower wage job, you're entitled to a premium tax credit to assist you in getting health insurance that you haven't been able to get up till now.
That's right.
I had a woman a while back at a Relay to Life gathering come up to me in tears because her sister had breast cancer. And when she went to get treatment, she learned she only had $25,000 of treatment to get radiation and chemotherapy to treat that condition, and they wouldn't let her begin the treatment because it was going to cost so much more than that.
Right.
What happens to a woman like that who was left as a victim to the fine print put in there by her insurance company that she knew nothing about as a typical insurance purchaser? What happens to her under the Affordable Care Act that they want to derail?
So even those provisions are in effect even today and have been since September of 2010. Lifetime limits are no longer permitted, so you can't put a cap on the amount of money that an insurance policy will pay over the course of the person's lifetime. And annual limits have been phased out, and now beginning in 2014 will also be completely eliminated, so an insurance company can't say we'll only pay a certain amount of money in a year for your claims.
And as far as rights that exist right now under this Affordable Health Care Act, the same Affordable Health Care Act that the latest thing in the last few days has been whether they're willing to shut down the entire government, threaten the full faith and credit of the United States just because they're so zealous about derailing the Affordable Care Act and denying rights to Americans. Right now, if you're a senior, do you get any rights that if we repealed the Affordable Health Care Act, you would be denied that you get under the Affordable Health Care Act already?
There are a number of rights under the Affordable Care Act. For example, preventive services are provided free of any copay or any deductible. That's just an example, so people can actually get the kind of preventive care that they need to keep themselves healthy.
And prescription drugs, are there any benefits that if we repealed the Affordable Health Care Act, seniors would be denied that they have today?
The so-called donut hole was closed by the Affordable Care Act, so millions of seniors have saved money as a result
And
of
the
closing.
solvency
Thank
of
you. Time has
Medicare would be
expired.
reduced also by
That
almost
answer
10
will have
years.
to be
Thank
the
you.
end of it. Thank you.